Hello guys, hope you are enjoying good health. Now we are going to start autonomic nervous system. Autonomic nervous system consists of parasympathetic nervous system and sympathetic nervous system. In parasympathetic nervous system, on preganglionic neurons, it releases acetylcholine which acts on neuronal nicotinic receptors on ganglionic end. While on postganglionic end, it releases acetylcholine which will act on muscarinic receptors. There are various types of muscarinic receptors, M1, M2, M3. It acts on various organs like heart, smooth muscles and glands. While in case of sympathetic autonomic nervous system, it releases acetylcholine on nicotinic receptors on all ends. While in postganglionic neuron, it also releases norepinephrine which will act on alpha or beta receptors. These receptors are also different types: alpha 1, alpha 2, beta 1, beta 2, beta 3. These are present in heart, smooth muscles and glands. While it also releases acetylcholine on postganglionic neuron which will also act on sweat glands, piloerector muscles. In neurohormonal transmission, acetylcholine is released by adrenal medulla, and further in postganglionic neuron it will increase epinephrine which will act on alpha or beta receptors. Similarly, in case of neuromuscular junction, acetylcholine is released which will act on NM skeletal muscles. Autonomic nervous system basically maintains the homeostasis. Now we are going to see how autonomic nervous system works to control the blood pressure. Blood pressure is equal to total peripheral resistance times cardiac output, while cardiac output is equal to heart rate multiplied by stroke volume. So increase in blood pressure is detected by baroreceptors, and then it discharges and signals are sent to parasympathetic nervous system and sympathetic nervous system. Parasympathetic nervous system will increase the vagal tone which will further decrease the heart rate, while sympathetic nervous system will decrease the sympathetic tone which will also decrease the heart rate. Increase in total peripheral resistance due to stimulation of alpha 1 receptor will cause reflex bradycardia, while decrease in total peripheral resistance due to stimulation of beta 2 which causes the vasodilation, there will be occurrence of reflex tachycardia. What will happen in case of decreased blood pressure? There will be an increase in vagal tone in case of increased blood pressure, but in case of decreased blood pressure, vagal tone will also decrease, that will increase the heart rate. Likewise, in sympathetic autonomic nervous system, sympathetic tone will increase which will increase the heart rate. In this way, the blood pressure will be increased. ROS system, also known as renin angiotensin aldosterone system, also acts to regulate the blood pressure. In case of decreased blood pressure, there will be a decreased renal blood flow which will increase the secretion, renin secretion, and it will increase the sympathetic drive. Sympathetic drive also increases the renin secretion. Increased renin secretion is accompanied by increased level of angiotensin. So there will be two functions. Increased angiotensin will increase the total peripheral resistance, while it will also increase the aldosterone levels. So we have also studied that increased total peripheral resistance will increase the blood pressure, while in case of increased aldosterone levels, there will be increased retention of sodium and water. So increased retention of sodium and water will cause increased blood volume. Enhanced blood volume will cause augmented cardiac output which will amplify the blood pressure. So blood pressure, to control the blood pressure, we will use ACE inhibitors, angiotensin converting enzyme inhibitors, and ARBs, angiotensin receptor blockers, to decrease the renin secretion. This diagram shows the interpretation of blood pressure. Upper line represents the systolic pressure while the roll line represents the diastolic pressure, while baseline is mean blood pressure. So if there is an increased systolic blood pressure, there will be increases are seen as deflections of tracings upward, while decreases are seen as deflections of tracings downwards. Mean blood pressure remains in steady line, while the interval between two diastolic or two systolic blood pressure lines is considered as one line. If they are closer tightly, increases are seen as tighter tracing, so it means there is increase in heart rate, while decreases are seen as wider tracing. If you see the wider tracing, it means there is a decrease in heart rate. This diagram shows that drug X will decrease the mean blood pressure while it will increase the heart rate. Thank you so much.